rapamycin, okay? How does it work? Using rapamycin, how would someone use this in, say, kidney disease or chronic cardiovascular disease or diabetes?
Most of these people aren't just on rapamycin, they're also on a very high dose of prednisone and or 2 or 3 other drugs.
Hi everybody, welcome to the Kidney Coach YouTube channel. I'm naturopath Fiona Chin, co-founder of the Kidney Disease Solution, Kidney Coaching Cryogenesis, and I'm joined again today by the fabulous and wonderful Dr. Morgan Camp. Dr. Camp is a functional medicine practitioner. He's been working for 20 years now in the functional area. So for anyone listening, most of our people on our channel have kidney disease. So why don't we start really high level? Why are we even discussing this topic? What does this have to do with people with chronic kidney disease?
Yeah, pretty in a nutshell, as kidney disease progresses, the main mechanism is through fibrosis, right? So the kidneys are fibrosing. And that, that's like an inflammatory state. So what is behind inflammatory states? Senescent cells. So what are senescent cells? These are these, quote, zombie cells, which we'll dive into in a bit. And these zombie cells are what release the inflammatory chemicals that fibrose and scar tissue, like those in the kidney. So rapamycin is what we call a cynomorphic, meaning it doesn't kill senescent cells, but it slows down the growth of senescent cells. So what rapamycin is really good for is not reversing an illness, but preventing the progression of it. It might have slight reversal in some cases, but and we'll go through how this works, but the main takeaway for rapamycin is you want to start it, around age 40 or so or later, because that's when disease progression via senescent cells typically starts in most people. And we'll go through how that works and the mechanism of that and such.
Yeah.
But yeah, around age 40, basically you're getting these inflammatory cells called senescent cells that are damaging organs like kidneys. So the damage that's there, from those senescent cells can be reversed in some ways, but not necessarily via rapamycin. So again, and we'll dive into the how and why of that. And there are other treatments, again, that might be more effective if you have a more progressive disease. But again, rapamycin is actually FDA approved for people who have had kidney transplant and who want to avoid organ rejection. So we know it's very safe for the kidneys because many people it was FDA approved in 2009. So at this point, millions of people have taken it every day for many, many years. And they have studies on those populations. And I think one of my slides will show that in those populations, there's a reduction in kidney cancer, I believe, in people who are taking rapamycin for transplants. Yeah.
Tell me, rapamycin, so most people think of rapamycin if they've come across it as a drug, but it was actually discovered as in the dirt in Easter Island. Have I got that right?
Yes. So it was discovered in 1965 in the soil of Easter Island. Scientists I don't know what they were looking for, but they scooped up soil. And then it's a long, fascinating story, how it happened, how they discovered it. They basically, some chemists were working for a company, and then they put it in their freezer at work. Then the company went out of business, and then they trained the chemist, like the last second, grabbed that bag out of his freezer. They didn't even discover what they had for 10, 15 years, I don't believe, and I don't remember all the details. But it took a long time for them to discover actually what they had. So it's actually an antifungal from the soil. And it's interesting that an antifungal is at the heart of treating a lot of chronic illnesses here and preventing those, interestingly enough. But yeah, the name Rapa comes from Rapa Nui, which is the native name for Easter Island.
So let's go into using rapamycin. How would someone use this in, say, kidney disease or chronic cardiovascular disease or diabetes?
So here, yeah, the rapamycin, the half-life is 62 hours. That means every dose you take will stay in your body for about a week or longer. So
Yeah,
that's why
wow.
you have to dose it. And you don't want to block the mTOR2 because that's where all the side effects come from rapamycin. So you just want to block the mTOR1, and that's why you want to take the low dose of rapamycin. So if you
Yeah.
take it daily, you're going to block mTOR1 in an mTOR2, and that's where the more side effects come in. You know, Dr. Green he prescribes on the higher dose, like he gives everybody 6 milligrams. He gives them also a azithromycin just in case they get a lung infection or a cough. If they get a cough or a fever, he says just take the azithromycin, don't think twice.
Okay.
I have never seen a lung infection in my patients, but I'm dosing people a little lower. I typically dose people in the 3 to 4 milligrams a week range, just
Yeah.
because I have patients that are more sensitive
Mm.
and more prone to getting side effects because they're more sensitive. And I found the 3 or 4 milligrams to be a sweet spot where people are getting what feels to be long-term benefit without getting skin infections or lung infections or canker sores. I got the
Yeah.
canker sores once when I was taking 6 milligrams consistently, and I was like, yeah, I don't. Let's bring that dose down.
Yeah, that's definitely the side effect that I get. I'll put your website details below. If you Google Dr. Morgan Camp, his details will come up, and his actual website where you can contact him is drmorgancamp.com. If you go onto the website there, there's an intake form, and you can do a concierge service through there and give him a contact. Dr. Camp, thank you again. Remember to hit like and subscribe. That way you'll get notified anytime we put up new videos. If there's any content that you would like Dr. Camp to talk about, please put in the comments below, and I'm sure I can wrangle him back into doing another podcast for us. And remember to head to our website, www.kidneycoach.com, to find out more about what we do. In the meantime, thank you for being part of our community, and we look forward to seeing you next time. Thanks again, Dr. Camp. Really appreciate you.
Thank you.
Bye.